Welcome to the Forte Sports Medicine and Orthopedics preoperative presentation for total hip replacement. This PowerPoint presentation will cover important details regarding how to prepare for your surgery, healing timelines, rehabilitation expectations, and return to activity guidelines. Materials presented today will encompass both the anterior and the posterior surgical approaches for a hip replacement. There are just a couple of subtle differences in the post-operative care between the two approaches, and those differences will be clearly noted in the presentation. So the first thing you want to think about is preparing yourself for surgery. So you want to try to get all your ducks in a row so that after surgery, everything is all set and ready to go for you. So if you live alone, plan to have somebody stay with you for at least maybe 4 to 7 days after surgery, especially at night. You'll need somebody to help with some daily needs of getting meals, maybe taking a shower, getting ice for your hip, those types of things. Prepare ahead of time in terms of meal prep, getting all your laundry done, all other basic household chores. You won't be able to do those very well for 3 to 4 weeks after surgery, so having some assistance on a regular basis is helpful. Please arrange for someone to do your lawn care for at least 6 weeks after surgery. And also arrange for some transportation to your first 2 to 4 outpatient physical therapy appointments, as you may not be driving yet. Some other points for preparation. In particular, we want to help reduce your risk of falls during your recovery. So please keep your pathways and hallways clear of debris and pets. If you have any of those small little throw rugs by sinks and toilets, these are the kind of throw rugs that you can kind of pick up and shake outside and put back down, not the big area rugs. But pull those small ones up until you're walking normally without your assisted device. They are tripping hazards for assisted devices, so we want to make sure you do not fall. Consider adding some sort of grab bar, whether it's permanent or temporary, near toilets and shower to help balance yourself as you're standing and sitting or stepping in and out of your shower. If you have pets, please arrange for pet care, feeding them, walking them, all kind of care that they may need, depending on your animal. And also, there's no walking dog for about 6 to 8 weeks after surgery, just in case. It's just a way of preventing any accident if a dog should pull on the leash and pull you down, or you trip on the sidewalk out there. That's why we ask you to do that. At night, and this is very important, to reduce the risk of falling at night when you're getting up and going to the restroom, we want you to turn on the room lights. So we would ask that you turn on a light next to your bed, like a lamp, and so that the room lights up pretty well. We need you to wake up and be fully awake as you use your assisted device, whatever that might be, to and from the bathroom. When you get to the bathroom, please turn the bathroom light on. The more awake you are, the more physically balanced you are. And we've had very, very few falls from turning lights on at night. You can stop turning lights on and go by your night lights again, maybe 5 or 6 weeks after surgery when you're walking more independently and smoothly. Here are some lists of equipment that you're going to need to help after surgery. The top 4 in red are pretty much everybody needs to have these. So you will need a walker with 2 wheels on the front, not the type with 4 wheels and a seat. You will transition then from a walker to a single point cane, and then eventually off of that cane. For anterior patients, we do need to have you to purchase a leg lifter. It's a device that helps to lift that leg in and out of bed, on and off the couch, in and out of the car, because your incisions on the front of your hip, right over those muscles that do that action of lifting your leg. And everybody needs a reacher grabber device to help pick up if you drop something on the floor. It's something to use to help pick up that item and bring it to you. We ask that you not bend over to get anything off the floor or a lower cabinet or drawer for about a month post-op to be on the safe side, again, not falling. The next items here, the elevated toilet seat with or without handles, or safety handles for the toilet. Basically, those are devices that you can look online for these. They are carried in many stores in your area or online. But a raised elevated seat, obviously, that just raises your toilet height up. So if you have a standard toilet, you may consider needing one of those. If you have a taller toilet, but you don't have anything to help push off of to stand up or to use your hands to help guide your way down, the safety handles for the toilet are those things that you can purchase and just clip to your toilet. And they provide an arm, kind of like the arm on a chair for you to push up on to stand up and then to use to sit down. Shower chairs or benches kind of depends on your balance needs. They are optional. For those that have a shower tub unit where you have to step over the bathtub to get in and out, you may need a shower board or some type of chair or bench that you can easily sit down on and swing your legs around carefully into the bathtub without falling off the edge of the bathtub. A long-handled shower sponge, again, that's optional, as you can't really bend forward and reach past your thighs for a couple of weeks to wash your legs. If you live alone, the sock donner is a useful device to help put your socks on, and you don't need somebody to do that for you. Again, your ability to bend forward right after surgery for about a month is pretty limited because of swelling and incisions. A long shoehorn, that's optional but useful. And the last item there is called a car assist handle. Again, you can Google this. It is a small device that is helpful to place in the locking device of your car frame. And it provides a handle for you to use to help stand up and sit down controlled in your car. So the top four you really have to have. The others kind of depend on what your needs are and what you already have at home. So a few items that you need to carry in with you on the day of surgery. If you have your walker at home, please bring that with you. You will use that after surgery. The inpatient physical therapist will have you up walking that same day of surgery. Bring your ID and insurance card. If you are having home health physical therapy come to your home right after surgery, please bring your cell phone. That home health PT agency will call you the day of surgery and arrange the time for a home visit the day after you are discharged. So they start the day after you get home with home health physical therapy, okay? Please wear some loose, comfortable clothing, as your hip will be swollen and you'll have a Band-Aid, a big kind of wound dressing on it. So you don't want anything tight for the road home. If you use a CPAP or a BiPAP machine at night, please bring that with you. No need to bring the water. We have that here, but please bring your machine. And if you know you're going to stay overnight, or if there's any chance that you may be staying overnight, or perhaps you live greater than a half an hour from the surgery center, you may want to pack that overnight bag. You don't have to bring it in right away. You can leave it in the car and whoever's with you can retrieve it at a later time during the day. So on the day of surgery, you'll give those items we just spoke about. You'll give those to the nurses. They will get you ready for surgery. You will go into the OR, and from the OR, when you're finished with surgery, you'll go into the recovery room for approximately an hour, assuming all is going well, that is. And from there, they will take you back into a private room. Once you're back there, and a few hours after surgery, the inpatient physical therapist will come in and check on you. If your ability to move your leg has returned, they will start doing these exercises you'll see on the slide here with you. They will give you an entirely brand new exercise sheet with pictures of these exercises. They will instruct you on how to do these exercises, and you will have to do them there with them. And these are to be done very, very gently. The reason we do these exercises particularly gently is because it should feel good to do these exercises. These exercises done gently can help reduce some pain, some stiffness in the joint that you get post-operatively. Plus, they help to improve circulation to reduce your risk of blood clots. I'm not going to go over these in detail because the inpatient physical therapist will, but you will have instruction with these the day of surgery. Once you've done these exercises in bed, you will then get up and walk the hallway with your walker with the therapist. And they will also teach you how to safely ambulate a set of stairs. And then you get to go home if all is well. Stair walking, again, they're going to teach you how to do this, but it's very simple. Many of you already do this form of walking pattern on stairs. When you go up the stairs, you always want to lead with your non-surgical leg. That's important. When you come down your stairs, you will lead with the surgical leg. Again, we'll practice this in the hospital, and you'll be very confident with it by the time you leave. Right? If your bedroom is on another floor than the main level, so perhaps you live in a tri-level home, or your bedroom's up on the second floor, or perhaps it's in the basement, we want you to limit the number of times you go up and down those stairs to 1 time a day. The stairs are an area of a much greater falls risk. So if you want to go to your bed at night, please feel free to do that. And then come to an area down on the main floor where everybody's there to help you out during the day. But once you're there for the day. Sitting and standing safely after surgery. Again, the inpatient physical therapists are going to teach this to you. You will also learn how to do this in your prehab physical therapy appointment that occurs right before surgery in our outpatient department. But basically, you always want to position your feet and knees wide apart. I would keep your knees outside the level of your hips. That's a very safe position for your hip. We do this and teach you this to help reduce your risk of dislocating your hip anytime you stand up or sit down in particular. So knees and feet tend to be wide apart. That surgical foot on your surgical leg, maybe you want to scoot forward just a little bit to take the angle away from your hip a little bit. When you stand up, always use both arms to push up from your seated position to stand to the walker. And when you sit down, you will take your hands off the walker and reach back with your hands to your surface and lower yourself with control to sit down. No plopping, because that really does hurt your hip. The big take-home point here is, besides having a wide base of support, which is the knees and feet nice and wide, is not to pull on your walker when you're starting to stand up or sitting down, because the walker can tip and you can fall to the ground. The inpatient physical therapist will be teaching you this and practicing this with you on the day of surgery. So if we take a look at what are your most important immediate post-op goals, they are reducing your pain and swelling to help restore the range of motion in your hip and improve your overall mobility for daily living. All right. So the more swelling you have, you tend to have more pain. Pain and swelling kind of work together. As that increases, or we can't control it enough, we can't obtain enough hip motion for you to be mobile, comfortably anyway. So to be able to sit and stand comfortably, to be able to walk with your assistive device comfortably, to be able to sit down and maybe raise your leg and put it through your pants comfortably. So pain and swelling control is a very, very critical objective starting from the day of surgery. So we want to keep pain tolerable and controlled. That means on a 0 to 10 scale, where 5 is moderate pain, 10 is severe pain, and 0 is nothing. Controlled pain is considered to be somewhere on your pain scale 5 and below. So that's 0 to 5. We consider that controlled. We're going to modify activity levels for especially the first week quite a bit, but you'll be able to do a little bit more as the time goes on. But as we're being a little more active, we're always watching how your hip responds to that, and not do things to create more pain and swelling where you perhaps may lose motion and suffer mobility issues. Right? Very first rehab goal we have for you, and this is very important, is that you learn to walk without limping on that surgical leg. And you will gradually transition from the walker to the cane, and then eventually nothing. And the whole goal is to be walking normally somewhere in that 4 to 6 week period of time after surgery. The criteria that we use to discontinue the use of the cane is basically your ability to walk without limping on that surgical side. Your physical therapist will determine when to make these transitions for you. My best advice is to always listen to your new hip joint. It's the boss. It will tell you what it's ready to do, what it's not ready to do, what it's comfortable to do, and what it's not comfortable to do. So please listen to it and be advised by it. Wound care is very simple. When you wake up from your surgery, regardless if you have an anterior or a posterior approach, you will find a very long wound dressing over your incision. That wound dressing is waterproof. So whenever you feel well enough to take a shower, it's okay to do so. Let the wound dressing get wet. It's waterproof. Just let the soap and water run over it. Gently pat it dry as you're getting dried off and get dressed. And that's pretty much all you have to do with it. You do want to take a look at it every day. Make sure your skin around it looks healthy. You're not having an infection, signs and symptoms of an infection, or getting a rash from the adhesiveness of the Band-Aid. On occasion, that might happen. If you have anything suspicious going on or you have a concern, please call your physician. In your discharge instructions from the hospital that day, they will tell you what date to take that Band-Aid off. That wound dressing comes off in 7 days. Once it comes off, that wound is glued together. So it's sealed off pretty well. So it's okay then to continue to let it get wet in the shower. Please don't scrub on it. Don't bother it too much. Go ahead, get out of the shower, pat it dry like you've been doing, get dressed, be about your day. It is okay to put lotion on your skin around the incision, but please don't put anything on the incision until you've cleared it either with the doctor or the physical therapist. If there are any bleeding issues, that is an immediate call to your surgeon. Again, some more information with wound healing. And these are good to be aware of, right? So we don't want people to be afraid of their hip necessarily or doing anything that out of the ordinary that you might do to hurt it, but to be respectful of healing times. So the skin, regardless if you're an anterior or posterior approach, the skin takes 4 to 5 weeks to completely heal and form a scar. Internal sutures, which you will have, take anywhere between 8 and 10 weeks to dissolve, form a scar, and completely heal. Your brand new joint, if it has not been cemented, the brand new joint requires about 3 to 3.5 months for the bone to heal into it to be 100% stable. At that point in time, you're pretty well healed. Your hip may not tolerate certain vigorous activities, for instance, gardening, a lot of yard work, those type of more vigorous activities, golf swinging. And so we wait till we're about 3 months post-op before we kind of initiate some of those more vigorous activity. But it may take you 4 to 5 months after surgery before you can return to all of your activity and your hip is very quiet and doesn't talk to you and let you know it hurts. If for some reason it starts to talk to you while you're doing an activity, please listen to it and don't force it to do anything it's not ready to do. Use pain as your guide. So, because pain and swelling reduction is so important, here are the items. These are the things that you can do to help reduce that pain and swelling. And you'll be focused on pain and swelling reduction as you move along through your rehab. Of course, the first couple of weeks are probably the most important because you're immediately post-op or you're getting more pain and swelling from that, and then it gradually goes down and you gradually heal. So number one, the exercises that the physical therapist showed you in the hospital or the surgery center, those are the things you kind of do with your legs elevated. Doing them gently helps to reduce pain and swelling. It is okay to lightly rub your hip area, just not directly on your incision. Sometimes that light rubbing everywhere around the hip, the incision, and then around the hip area into your thigh a little bit, that feels good to do and can reduce pain and swelling. During the day, and this is very important, during the day, we need you to get up once an hour and walk 5 to 10 minutes with your assistive device, and then come on, sit back down and rest. So that brief hourly walking is one of the best things that you can do to help reduce your risk of forming a blood clot anywhere in your body. So we actually want you to do that for about a month post-op. Changing positions frequently too is also very useful. So your hip will tell you when it's comfortable in a position and when it's not. So go ahead and change a position. You can be in any position that's comfortable for your hip. Again, your hip will guide you. Cold therapy, we're going to use any form of cold therapy you want. All right, so whatever device you have at home is just fine. We're going to place it on your hip for a maximum of about 30 minutes at a time. Then we take it off for about an hour, let that area come to room temperature so it's not super cold all the time. And then you can put your ice back on. So it's basically 30 minutes of ice, take a break for about an hour or so. When it starts getting sore again, place the ice back on. Please do not put it directly on your skin. We need a layer of cloth there between the ice device, whatever that is, your ice pack, and your skin. And that's just to protect your skin so we don't get any frostbite issues or interfere with wound healing. And lastly, you'll be on some medications. Now, the nurses are going to go over with this in detail with you in this when you're discharged. You will be on Tylenol if that's a medication that you can take, and that's very effective in combating post-operative pain. And you will have a narcotic pain medicine to take. And we generally are asking you to take that as you need for that uncontrolled pain. So pain that starts to rise above the 5, the 6, that's a pain level that makes it uncomfortable, where you can't find a comfortable position to get into. Walking hurts more. It hurts. You don't want to do your exercises. Maybe you can't sleep at night because it hurts so badly. That's the time when you're probably going to rely on your narcotic medication. But if you can do these other steps, light exercises, gently rubbing, changing positions frequently as your hip asks you to, getting up and walking for 5 to 10 minutes per hour during the day, the use of your ice, all those strategies should be able to help you control your pain and swelling. If they don't, that's when you can take your narcotic. So a little bit about bed mobility and sleeping positions for the first month. For both the anterior and the posterior approaches, these apply. You can lay on your back with your surgical limb resting either flat on the bed, or if that's a little bit uncomfortable, it is okay to take just one pillow and put it underneath your leg, any position you want. The other option is to lay on your non-surgical side with pillows between your knees for support. Now, here's the key to be comfortable with that. You have to have at least 2 pillows, or maybe a super thick single pillow. But the important thing is that when you lay on your side with that pillow support, your surgical knee or your surgical leg should be positioned slightly higher than your hip. This is the position that can help eliminate pain and let you sleep comfortably at night. It happens to be the most favorite position for all hip patients to sleep in at night. So 2 options for you. You can lay on your back, or you can lay on your non-surgical side. We don't want you to lay on your surgical side until that skin has healed, and that's approximately a month, 4 to 5 weeks for most people. Once the incision is healed, it is okay to gradually ease your way over onto that surgical side as pain allows. Right. For people with an anterior approach, be sure to use your leg lifter device to help lift that leg comfortably in and out of bed and on and off the couch. We do not want anyone pushing through hard, sharp pain after surgery. If you have a posterior approach where your incision's on that buttock area, the only thing we ask here is that you, as you get in and out of bed, or you sit up to from a laying down position, or you're sitting and you go to lay down, we don't want you to pivot around on that surgical buttock. That way you're not pulling on the incision. Some basic movement precautions that can help you prevent or reduce your risk of dislocating your hip. One of the best things, when we've already spoken about this, is anytime you go to stand up and anytime you go to sit down, let's bring your feet again about hip or shoulder width apart. So we call that a wider base of support. And if you still need a little help to help assist your way down without plopping into a chair or to stand up, always use your arms to help you stand and sit with that wide base of support until your legs are strong enough to do it independently. When can you start to lean forward and pick something up off the floor? Your physical therapist is going to let you know that. Usually we don't let anybody do that until you're walking normally. But if you feel you're ready, ask them while you're in therapy, and we can practice this in therapy and make sure you do this safely and you don't risk hurting your hip or falling. So 2 of the really safe positions for your hip are when you bend forward, you put your non-surgical leg forward and put your surgical leg in the back. So it's on the floor in the back. It's kind of like what a golfer looks like when he picks up the ball out of the cup. So you're leaning more on your non-surgical legs, surgical legs in the back on the floor. We'll cover these positions with you in your prehab visit just to give you a demo. The other option is just to simply, with your feet and knees wide apart, to bend your knees a bit and your hip and actually squat down to get to the floor. That is a very safe position for your hip. Anytime you get your feet and knees further apart and you're bending at the hip and the knee, and you can see the inside of your knee and your leg and your ankles. Anytime you're doing something to bend forward, whether you're sitting or standing, and you can see the inside of your knees, feet, and ankles, you're in a safe position. That means your hips are wider than, your knees are wider than your hips. That's safe, okay? Eventually, the therapist will have you sit, teach you, get your motion going, and we'll get you working to sit in what we call a figure 4 position. That is a position where you're sitting in your chair and the ankle of your surgical hip is sitting on the opposite knee. That is a safe position. Again, when you're sitting in that position, you can see the inside of your knee, lower leg, and ankle. It takes us about anywhere between 5 and 7 weeks after surgery to get you comfortably in that position. And this is the position we want you to use pretty much for the rest of your life, to put your shoes and socks on, tie your shoes, care for your feet. That is a safe position. If you're having a posterior approach, okay, so that's everything for an anterior and posterior approach. But if you have a posterior approach, for those first, I would say the first couple of months, don't pivot on the surgical leg while you're bending forward past 90 and loading your leg. So what that means is perhaps I'm bending forward and my knee's not outside my hip, excuse me, and I start to pivot on that leg. You really don't want to do that. That could put you in a position where your hip could potentially dislocate. So again, it's a combination of things. Putting weight, or what we call loading your leg, while you're bending past 90 and your knee is not outside the position of your hip. If your knee goes inside the position of your hip while you're bending forward and loading that leg, that is a position with that knee inward. That's the position that could potentially cause a hip dislocation. So it is okay to bend forward past 90 if your knee is outside your hip. Unloading and loading the dishwasher or the dryer, or bending forward with your foot up on the side of the tub, or like a retaining wall if you happen to be outside to try to tie your shoe. Those are positions where you are loading your leg, moving forward over your knee, and you are far greater than 90 degrees of knee bend. On occasion, I have seen those positions cause a dislocation. We have very, very, very few dislocations after surgery because we just inform people how to do the proper mechanics and techniques for reaching the ground on your feet. Physical therapy. So this is kind of what it looks like. You will have inpatient physical therapy the day of surgery. Then you come home, and if you're having home health physical therapy, most of our patients do have that. If it's for a hip, depending on the doctor, it may be 1 to 2 weeks. And they will be there at least 2 days per week to see you. Home health works a lot on reestablishing a normal walking mechanics for you. They will add a few more exercises to help strengthen your leg to improve your walking mechanics. They may be the person that starts to transition you from the walker to the cane. If you're not ready for that transition yet, by the time home health physical therapy is finished, we will do that in outpatient physical therapy, which starts after you've completed home health. Now, if you are a patient that is not having home health physical therapy, that means you will probably start your outpatient anywhere between 3 and 5 days after surgery. So you'll continue just to do the things the inpatient therapist has taught you, and all the things we tell you to get up and walk once an hour, you'll continue with those. Outpatient physical therapy takes you through the rest of your rehab. Whatever your goal is our goal. We will see you anywhere between 2 and 4 months, usually once a week, to get you back to however long it takes to get you back to doing the things you want to do. So if your goal is to get back into the gym and work out at the gym and do some weight training or use of cardio machines, we will get you ready to do that. If your goal is to be able to golf 18 holes in a day, we will get you ready to do that. We generally don't do golf swinging until around 11 or 12 weeks post-op, but we will get you ready to do that when the time comes. If your goal is to do CrossFit classes, we will get you ready to do those CrossFit classes. High impact is not something we do want to ask you to do ever for an exercise, so we'll do some modifications there. But basically, whatever your goal is what we get you ready to do. Now, the more vigorous that goal, the longer it takes us to get you ready, get your strength back, get your balance back, get your leg endurance back, to be safely to go do those things again. For both anterior and posterior hip goals, from the day of surgery, and as you progress through those next couple months, we always want to keep control of your pain and swelling for a comfortable rehab progression. We want to make sure you don't lose your motion, so we don't lose mobility, your mobility. We're going to gently increase leg strength to improve walking capacity without the need for an assisted device. That's initially. Then we increase that leg strength so that you can go up and down stairs with a normal step over step gait pattern. Then further on, to get you back into your activity levels. We do avoid that vigorous exercise and pivoting for several weeks so that we can allow all those tissues from the skin, internally, and into the joint, let everything heal. So the criteria to go back to driving is this. Number one, you have to be off your narcotics. And number two, if the surgical hip is your braking leg, you've got to be able to slam on the brake really hard and hold it so that in case of an emergency, you can do that and control your car in any situation. So safety is a key issue there. Usually for a braking leg, if it's the hip involved in your braking leg, on average, I kind of see people ready to go back to driving and being able to brake hard around the 3 to 4 week period. If you're your non-braking leg, that kind of is somewhere maybe in a 2 to 3 weeks because you don't have to use it. So it's basically when you're off of narcotics and comfortable getting in and out of your car. If you are a very young hip replacement, perhaps you've had some hip dysplasia or you have AVN, and so you're in your 20s, 30s, 40s, you're probably going to have hip control, leg control to brake a little sooner than that 3 to 4 weeks, and that's fine. As long as you can brake hard, you're ready to go, and you're off your narcotics, you're ready to go. So just in general activity modifications, that first month, we're going to take it easy. You got to consider if you are working outside the home or if you're even working at home, even a desk job, to go back and sit all day long at a desk job, even at 2 weeks out, is not recommended. It can create more pain and swelling. So if at all possible, you can take your first month off work. Kind of depends on what you do, and you can have this conversation with your therapist and the doctor. But we basically don't want you doing household chores, laundry, standing to prepare and cook meals, or doing any additional walking outside of what you have to do to get around the home or down the driveway and back. Please don't plan to go on shopping trips or concerts or fly within the that first month of surgery. Any air travel needs to be cleared by your physician. Generally speaking, if you're flying and you're more than a month out, we're going to be okay with that, but you do need to call your doctor and let them know you're flying. They may want to put you on a blood thinner while you fly. So again, that first month is really critical to calming your hip down, gaining motion, learning to walk without an assisted device. That takes close to a month at least, maybe 6 for some. So we're really focused on meeting those goals. Hip activity after surgery. For about everybody, 6 to 8 weeks out of surgery, you're doing a lot of light activities pretty comfortably in your house or outside in the community, maybe short little trips to the store and back. Those get pretty comfortably pretty quickly. Like I said, though, it may be 3 to 4 months before everything feels comfortable. And in terms of our rehab, we work a lot on gradually increasing walking with your assisted devices and then without them, improving your overall mobility for stairs, home tasks, being out in the community, resuming other normal household activities, the things we just talked about, and then going beyond that, what is it you want to get back into do? We will have that final phase of rehab to get you ready to return to exercise activity, regardless of kind of what it is you want to do. And with that respect, the next slide here talks about realistic activities. As you can see everything on the left side of the slide, these are not inclusive. There may be something here that's more low impact that you want to do that's not on that list, that's fine. But high impact exercise on a regular basis, which would be jogging, jumping, running, heavy weightlifting, we ask that you not do. Your hip does have a limit on what it can do, and you need to listen to it. There's just one caveat here. If you are in harm's way, or someone you love is in harm's way, or you're helping somebody who's in harm's way, you can feel free to run and jump and crawl, whatever it is you need to do to get out of harm's way. Your hip will be fine. We don't ask people to jump and run and jog on a regular basis because that regular high impact causes problems with the new hip joint. So in closing, we appreciate you for choosing Forte for your upcoming total joint replacement surgery. The entire Forte staff, physician staff and rehab staff, is looking forward to serving you throughout your surgical and rehabilitation experience. And our whole goal is to get you back into an active lifestyle comfortably and pain-free. Just a little footnote here. Earlier, I mentioned a prehab physical therapy visit. So that is a physical therapy visit that you do prior to surgery. It is a one-on-one appointment with a physical therapy specialist who specializes in total joints, patient education and rehabilitation. That visit occurs in our Forte Rehabilitation Department, which is located on the first floor of our building. And it is to prepare for it, if you have your total joint book, it is extremely helpful to read the material in that book first and even go through this presentation first. The visit is only about 35 minutes long, and there are certain things we will do that. We will do a brief history with you and a brief physical exam of your hip. And then we're going to focus more on instruction for specific equipment that you need, address strategies to reduce pain and swelling again. We will fit you for your walker. So if you have your walker, please bring it in. We will fit that to you that day and go over some really key points in order to prepare for surgery or post-operative activity guidelines. So we will have just a short period of time to do that, but it's a very, very important visit. So we look forward to seeing you at that visit, and have a good day. Thank you. Okay, Janet, that was it. Hope that worked. Hope we got it.
Me too.
Were you listening to it at all?
Oh yeah, I was listening to it off and on.
How'd it sound?
It
try not
good.
to stumble, to say, hey, oh yeah, or ums a lot. I know I kind of get words going crosswise, and I hope it's not